Our series with Global Choices continues, a series where we have touched on the softer side of insurance, the side we sometimes forget about. Today I'm speaking to Carmen Poultney and her journey with cancer. Carmen's journey is not just a story of survival, but of resilience, perspective, and the lessons that insurers can learn from the lived experiences of patients. A cancer diagnosis doesn't just impact physical health, it disrupts every area of life, emotionally, financially, and socially. Through conversations like this, we aim to uncover how the industry can support individuals more holistically, moving beyond paying claims to truly making a difference in people's lives. Welcome, Carmen.
Thank you.
So nice to chat to you.
Thank you.
So,
Looking forward.
so maybe, Carmen, maybe you can take us back to the moment of your diagnosis. What went through your mind? What was the very first thing you thought about? Talk to us.
Um, it is a bit of a blur, I think, because it was quite a traumatic time. I'd been chronically anemic for a year. I'd been to 5 specialists. I had been on every blood test, bone biopsy, blood transfusion, iron infusion, cameras down my throat, colonoscopies, gastroscopies. And I think my first frustration was that no one offered me a scan, which is actually not a very expensive thing to offer. They just kept doing more blood tests and scratching their heads and more appointments. And so my life that year was almost more difficult than this last year, 2024, being on chemo, because at least when you're on chemo and you've got a plan, you feel like you have some kind of control over what's going on. But when you're just going from doctor to doctor and people are saying autoimmune cancer, blah, 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 it's very scary, and I was exhausted. So in January 2024, I was eventually diagnosed. I actually picked up the tumor in my colon. My physician was clever enough to offer a scan for liver and spleen to see if the iron that I was losing was affecting my liver. And there they picked up Krukenberg's tumors on my ovaries, but yet the doctor still thought it was not a problem. It was just a mass of cells, and let me go for another month. And they were about to let me go for another 2 months when I said, but what is this big thing in my colon? And they said, oh, it's just your colon. So again, it's just I think the inability of doctors, because I think in South Africa they're very overworked, and I don't want to say empathy fatigue, but they're fatigued, and everything gets looked over. They missed the cancer with the colonoscopy. I basically got told by the doctor who gave me the colonoscopy to eat more Weet-Bix and less broccoli. That was my issue. So with all the pain and everything in my tummy. So again, leading up to it was quite a frustrating thing. And then when one's finally diagnosed and you're going like, how have the doctors not picked this up?
Yeah.
And the treatment we got in hospital, the surgeon, so we had 3 doctors come to tell us that I had stage 4 colon cancer. And the first doctor was, I'm sorry, this is bad luck. Then we had another doctor come in. I'm not even sure what they were about. And then the surgeon came in, and my partner was obviously, his emotions were up, and he was saying, like, what does this mean? And she kind of turned around with quite a cold tone and said, listen, we're here, we could operate, but we can't save your life. So all these little things that happen, I think a big thing, and I know what you guys are kind of focusing on, is the softer bedside manner and compassion, and kind of seeing everyone as an individual. I think the issue is there's a lot of cancer has tripled since COVID, and the doctors are just like, kind of, you're just another casualty. This is it. Our first oncologist we visited told us we had 2 years to 8 years to live, but not decades. And so it was kind of a cold prognosis. So that first month, when I think about it, it's quite a chilling month. You know, the actual realization. Of course, I've got 2 small children, so the realization that I just saw black like this. That's the emotion, you know, like that it's going to be this awful experience into kind of into cancer. And we very quickly realized that that's not necessarily the case. There are a lot of holistic modalities, and again, from an insurance side, you start realizing that there are a lot of ways that you can actually protect yourself. I know, I was on a normal hospital plan at the time, realizing that in this day and age, particularly after a certain age, one has to take out dread disease. It's just it's a reality,
So you didn't have dread disease insurance?
No,
Not
I was just on a
anything in
normal
place?
hospital plan. And that, with the costs of chemo, ran out within 3 months. I was diagnosed in January, and I think it's a bad time of the year to be diagnosed, because you basically have to wait till the next year to be, to start your next year of insurance. So the first thing I would say, obviously, is that dread disease story, and then just, like really doing your research into how much they're going to pay out. I think we got, I think it was, I can't even say, maybe 250,000 Rand or 350, but whatever it was gone within 3 to 4 months.
Yeah.
And so what I was trying to explain too is the stress in terms of insurance interaction is the labor that goes with, now you've run out, now you have to go on to minimum benefits fund, where luckily they will pay 90%, but every single hospital bill and every time you go into chemo, I've had 36 rounds of chemo, you would have to now fill out a form for the 4 different hospital bills that are encompassed with chemo every 2 weeks, and then fill out a form and send it off to, for it to be paid. So it becomes a real admin nightmare, and a chemo patient is not the right person to be dealing with that admin. You cognitively impaired, you are fatigued. If you really want to fight the cancer, you have to focus on the medical plus the holistic, and it's a full-time job. So it's one of those things where the easier the insurance companies can make it for the patient to just kind of get these things flowing and pass through, or a system, or even a counseling session before to say, keep a log of all your bills. I think after 7 months, I realized that they wanted a date in and out of hospital for every hospital visit, which wasn't necessarily put on the bills. So I had to phone the hospital and say, when was I there? And it's but like leaving your taxes for a year. It was just a complete nightmare. So we eventually did get most of the bills kind of covered, but the easier an insurance company can make it for the patient, obviously the smoother and better their healing will be. It's all about healing. We realize healing is not just about getting the right medicine, it's about having the right environment to heal.
Yeah. So you only had medical scheme. Well, you only had a hospital plan, right? Nothing else.
Correct.
So what if you are now in charge of, you're given free rein and they tell you, you've been through this experience. Tell us what exactly, as a medical scheme, we're not talking about insurers because that's now a whole different conversation. As a medical scheme, what should we put in place when someone has been diagnosed with cancer? You have now free rein to do that. What would you put in place?
Well, the thing is, of course, I think the thing is to put things into place beforehand, right? So, of course, that dread disease is imperative for anybody over 40. There's cancer diagnoses have been made anywhere. I mean, even people younger than 40 are getting cancer now. But it's the first and foremost would be to maybe have an actual person, because again, when you're calling call centers, it's a different person every time. You've got to explain the whole story again to a different person. We know it's so impersonal, and they don't know what's going on. That's like one no. To maybe have what we have now is you get a broker or somebody like a counselor to come in and say, okay, what do you need from us? This is even just a little plan out to say, this is what you've got. This is how long it's going to last. Maybe start making provisions for medical or financial support thereafter, instead of going blindly with your insurance for 3 months and then someone goes, oh yeah, your insurance is up, basically, or your medical scheme is your medical oncology benefits are done. So we kind of got told post them being finished that they were finished. So it's a kind of just a little bit of a preparation to say, and I think just the books, like have a book, have a logbook, keep your record every time you go into hospital, take a little screenshot, whatever it is. I think there's definitely some counseling that can happen from the professionals to help you, realize that it's never going to be. This is another thing, is that in our mind, it was a 6-month thing. You get 6 months of chemo. I'm now on my 4th 6 months. So you go 6 months of chemo, then another 6 months. When it's finished, then another 6 months. And now I've just taken out another 12 rounds of chemo. I'm going on to my 36 plus rounds. So you're going, it's not just a 6-month thing. You think it's going to be over and all the bills are going to be, you can deal with it after. Even if your chemo was only 6 months, there is post-chemo doctors' appointments, treatments. So you've got to just have your partner or a counselor. And I think the thing is, the partners are totally, my partner's done as much work and admin as me to try and support me, and he's still got to provide and go to work. So, to put it onto the family, and that's where you say it's not just the patient that's being affected. The whole family gets affected. So, it would really help from the medical scheme to have a person who comes in and sits you down and says, okay, calmly, I've got your back. This is what we're going to do. This is what you need to, think about in the year to come. We're maybe in July. This means you've got up until December. We don't even know, like at that point, we didn't even know when the insurance rolled over into the next year. All these things, you don't really pay attention to those things until you need to.
I think it's such an important thing that you mention around the communication. So my question really is, did you now phoned into your medical scheme to say you've got cancer? I'm sketching a scenario. Was there any form of, okay, let's talk about the process. Now, so you want to tell me that they literally have just said, okay, we noted and you have to claim. Is that how cold it was?
Yeah. There was no, I don't remember there being any communication with the medical scheme until the bills come in, and then you.
And
So
I mean, they can
initially,
clearly see you going for cancer treatment. So it's not as if it's a surprise for them.
yes, I think what happens is with the first few bills, you see you have your cancer, your ICD code, I think it's called, which
Yes.
is your cancer code. So on your bills, you just start putting your ICD code. That's another thing, is that between the hospital and the medical scheme, that about 50% of the bills were incorrectly put through. So they were rejected by the medical scheme. Then I had to go back. At one point, I think I'd phoned both the medical scheme and the hospital 5 times each. And the medical scheme says it's the hospital, and the hospital says it's the medical scheme, and the things keep getting bounced backwards and forwards, and you've got to go and track. And I had to get a scrap of paper and write down all the bills, the codes of the bills, the dates, the invoice numbers, and say, this is for this date. I was in hospital for cancer. Then they go, oh, okay, but the wrong ICD code is put on there. So another complication is that the medical schemes and the people who take blood banks, I don't want to mention any names, but get their wires crossed, and then it's up to you. There's absolutely no one on the other side trying to help you. So at one point, I had the blood guys and the medical scheme guys all rejecting the bills and saying the other one is responsible, one saying the other one's responsible. I had to phone the medical scheme and the blood bank 5 times on each side over a period of about 3 and 4 months, because you've then got to wait 5 days, and then you've got to follow up. Otherwise, the bill gets sent back to you again and saying that you're responsible to pay for it, and you've got to send it back to your medical scheme, and then they reject it. The whole thing was just so, there were many tears of frustration, because again, I say, you're not in the right headspace to be dealing with, trying to sort out the medical bills.
I feel I hear no empathy.
You know what? When you call the call centers, they're empathetic. But again, it's a call center. You're getting a different guy every single time. So you kind of need one person and that's why right in the beginning, almost a broker who is going to say, okay, I've got you back. If you're having trouble with this bill, send it to me and I will make sure it goes to the right person and assess whether it needs to be paid or not. But when you are getting hold of a different, and the call centers, bear in mind, we know you phone, it's 20 minutes, you get cut off. You know, there's all these things that you have to, it's hours and hours and hours and hours of admin to try and get your own bills paid that actually you're not supposed to even see.
Yeah. No,
So,
I think a broker would have definitely made a difference. But when I hear the added frustration you had around wrong ICD codes and things, that's where it will be difficult for the broker. That's a medical scheme and a hospital issue that is clearly there's a serious misalignment there.
Lack of communication, yeah.
100%. And that's all I hear from the start to now. What I hear from you is that if there's one thing that you could fix is that communication, because it's once you are diagnosed, that communication that you receive from your medical scheme, from your hospital, from everyone to say that this is the process, this is what you need to do. And I mean, you clearly still were able to do that, even though you were probably in a lot of pain and whatever. But imagine there's a single person that's going through this.
It's unmanageable.
How do
I
you
have
do
the
that?
best support system in the world.
100%. And yet you were so super frustrated.
Yeah.
Yeah. So there's a few gaps. You know,
Well, also, I think it's just that I think, like, if I put myself in the shoes of somebody who potentially, they say, living alone and being like on your own fighting cancer is very, obviously, it's much more stressful. But then the added frustration of not even having the backup there, saying if you have to deal with all this admin all on your own, and knowing that the amount of stress that adds is going to fuel that cancer, because we know the real way to heal from cancer is to change the way that you behave, or the way that you respond to the world or in the world. You have to draw back on your stress levels, and there you've got like such impacted stress, it's unmanageable.
What additional support do you think will help? And I'm talking something like getting to the hospital and back. In your case, you once again had help.
Again, my partner basically comes with me to every appointment. So it's very difficult for me to assess. I have insisted sometimes just Ubering home, or he'll arrive with me and then I'll Uber home, especially if I'd had procedure where I may not be, where they advise you don't drive home. But most of the time he would drop and fetch. So, I think in this day and age, people just Uber everywhere. But from your perspective, maybe like if one did have a service that could help, it would, just to make people feel comfortable. Even I think for like some people getting in and out of the car, if it was a case of really bad chemo, luckily for me, I've been quite strong and mobile all the way through. But different types of cancer, so I think some people would really kind of gravitate towards having somebody from the medical scheme to help. But for us, obviously, the family comes first. I have the family all waiting in a line, in a queue to sit with me through chemo, and I'm like, I just want to do some admin. You don't need to be here. But some people may need that assistance.
Did you just never think of the rare disease cover before this, or was it just not something that you think will ever happen to you?
No, I don't think it's something I thought would not happen to me. I think one's not aware. I was never told that rare disease was an option. I didn't know rare disease existed.
You clearly don't have a financial advisor or a good financial advisor.
No. And it is a situation where you are kind of penny saving. So again, my ex was paying for our medical aid, and he just took out the basic medical aid, and I was just grateful that I was still on that medical aid. So I wasn't going to be asking too much more than that. But to be dead honest, I had no idea there was anything that rare disease existed. And obviously now realized the advice is usually to drop down to a lower tier or whatever you do, and then take dread disease is more important than being on the, because my partner has been on a very high insurance, which obviously if you can afford it, but it's and he wasn't on dread, so now he's taken on dread and maintains that higher tier.
It changes one's perspective, right? When you go through that process.
Yeah, absolutely.
What was the most difficult part of your journey for you? The getting healthy, the emotional stress, the physical stress? What would you say was the biggest stress for you in this period?
I have to say that we have embraced this journey in a very holistic way. So I have to say, quite honestly, I know this is not going to be for most cancer patients. I'm happier than I've ever been. So, you face death and like right in front of you, and your perspective is very clear. I'm going to be dead honest, and I'll say my biggest frustration is not feeling anger and resentment towards doctors. And if I had to list all the things that have gone wrong in the last year and a half, I ended up almost in ICU with C. diff, which is a superbug, which my oncologist completely overlooked. I have a holistic oncologist. She's the only one in Cape Town and is absolutely overrun and exhausted because she just gets patients in all the time, asking for the holistic support on the other side. But I was put onto the strongest antibiotics you can get, and I saw on antacids, and apparently the combination is 90% likely to give you C. diff. So I ended up with a superbug. One port went necrotic, which means the skin died over it. I'm actually on active chemo at the moment. So I have a ball with me that I carry around. That's just out of interest sakes for everyone. That's my chemo.
Oh, wow.
And so I had a port here. The skin died. Then I had to open up one here. It never healed. It just got infected 3 times. I had to have that cleaned out 3 times. I had to go out of general anesthetic 4 times to have it put in and out and cleaned. They had to close this one up. Then I've got another one put in here. So I actually had to take a 2-month gap from my chemo, which escalated the chemo count to the point where I had to start almost all the way from the beginning again after being on chemo for 7 months already. So, but just in terms of even that year running up, I think the biggest frustration is wanting to go back and actually, it's not about blame. It's about confronting the doctors and saying they won't even know what happened to me. I'm just a patient who's in and out. They don't know if I got diagnosed or not because all I did is not go back to them. They don't know that, telling me that I'm a bit neurotic and that, eating more wheat bix and less broccoli was not the answer. You want to go back and you want to say to them, guys, maybe next time offer your client a scan, or, you feel like you kind of, you're just leaving all these doctors in your wake. And there's absolutely no accountability for even the people that miss the antibiotics there's no one accountable. Oh, your surgeon should have told you, your surgeon should have checked which meds you're on. It's not my responsibility. There's just a whole kind of string of frustrations. And as a cancer patient, again, it's not going to help you to hold on to them. So you have to, I just, in my mind, see this as my journey, and it's my journey to help other people going forward. So I embrace it as every little hiccup is just another hiccup that I can help other people prevent from happening. And it may make the journey longer, but there's a fine when you're trying to change the way you are in the world. It doesn't happen overnight. So I've just been extended a little bit more leeway to kind of have more time to learn the lessons and to really embed this new way of living into my life. There are also options, and I think another thing, I'm not even sure how the medical schemes can manage this, but there are many options overseas for vaccines, tailor-made vaccines. They aren't cheap. We're doing one that costs 2 million rand, but no one tells you about them. So I was delayed. I could have started mine 6 months before I did, but no one told me. So because they thought it was too expensive. So I think if one's really looking at the healing of the patient, one has to give them those options. And unfortunately, I think the reason they don't is because they don't want to offer somebody a 2 million rand solution if they don't have 2 million rand. But it's one of those things where anything that can help you, for medical, we were saying medical schemes should start really embracing alternative treatment in combination with chemo. So I go for vitamin C infusions twice a week. It's 1,500 rand an infusion. I pay for that out of my pocket. If the medical schemes could start bringing it into the oncology rooms or just kind of partially subsidize, it really does work, and it really does help the patient get through the chemo. There's absolutely no way, I know on God's earth, that I would have survived 36 rounds of chemo without the alternative stuff. And again, for the doctors cannot, for legal reasons, and I think just they can't open their minds to the holistic stuff because it just allows too much liability, community. There's a book called Radical Remission, which is about a physiotherapist who worked for doctors and started seeing all these radical remissions happening where people were just healing themselves, but the doctors were hiding the files underneath all the other files. And she confronted them and they said, but you can't tell the patients, you're going to just give them false hope, because you can't tell them they can go up into a mountain and they're going to heal. But the medical scheme perhaps can start trying to be the people to bridge, saying this is what you've got from the medical side and potentially this is what you've got from the holistic side, and maybe opening that door a little bit. That would be really amazing, because it's just education. And what I have realized in the last year and a half is, I think we counted on my hands, 6 things that are the most powerful healing modalities, and they're all free. So that's where the insurance medical scheme can come in, just with education: diet, fasting, sleeping, exercise, meditating, community. These are all things that are free. Reaching out to your community and asking for help, getting a support team, the 3 pillars of health, the exercise, the sleep, and your diet. Your diet alone can help you heal. So if one, as a medical scheme, can help patients realize that they have the control, the whole system will just work better, because they will allow themselves to, or facilitate themselves to heal quicker with their own, within their own capacity.
I love what you're saying. And once again, it comes back to the communication. I think there are probably a lot of schemes that try and bring over the message, but the way that you are saying it, and maybe sharing life stories from their side with people like you, where you really can see you are incredibly positive. You are so resilient. You are an example for, I think, so many people, because you just see this as an opportunity and nothing is going to get over you. So I really see that as such a prime example where medical schemes can say, don't let this be the end of you. Because it's also, I think number 7 is that mindset. I suppose it's part of meditation. But having the right mindset, number 7, I think will change so many people's lives, because it's so easy to just be negative and not be resilient, right?
And also just to be a yahoo. You cannot go into a situation and just say the doctors are going to tell me what to do and I'm just going to listen. Like you go into the chemo room, the first foundation diet rule with cancer is no sugar. You go into the chemo room and they're offering you cupcakes, and it's just you kind of go. Just in terms of that education, even offering as a medical scheme, saying these are the resources, it's a list of resources that you can do to help yourself feel better and to empower yourself alongside the chemo. It's not about not doing the chemo. And that's where people often go, it's either or. It's to say, you go and read this book. And if you read Radical Remission, you have proof that you can do it on your own. You just need to find that Pandora's box is there. You've got to just open it up and kind of figure out what your secret code is and where your stresses lie, And it's just so empowering. I mean, people, and another thing is, this stuff is all being proven now to be scientific. The meditation is being proven. If you look at Joe Dispenza's work, they monitor people's blood levels before and after the meditation, and the cancer counts drop within hours.
Wow.
This is science. It's science. It's quantum physics, and it's science, and it's so revolutionary and powerful that even if you wanted to help them, it'll take a lot for the medical schemes to actually scratch out and do the research, because obviously we've gone above and beyond to find out the modalities, but they are there. They're just not known. People don't know what to do. So there is no file to give the patients yet.
Yes. And how amazing would that be?
Them.
While you're talking, how amazing would that be? And maybe it does happen because we just don't hear about it. But in your case, you have been diagnosed. You get your very personalized message and communication and emails and whatever to say. This is now the journey you're on and the things that you have shared.
Yes.
How profound will that be? Because one, you can make the decision if you want to do those things. But two, if you are not empowered enough or don't have that mindset to empower yourself, the things you then get that information and you can decide what you do. And like you say, it is free stuff. A lot of it is scientifically proven. Why are we not doing it? It's such a basic thing, and everything in our industry, everything in the world moves towards that personalization, right? So how is that not an excellent example of giving your cancer patients that basic guidance to say,
absolutely,
this is a few tips for you that will change your life.
Absolutely. And then there's also, it's a strange thing to mention, but AI, Jane McClellan is an author of How to Starve Cancer, also a natural healing modality, very complicated and very difficult. And again, difficult to read the book if you're a cancer patient, difficult to make an appointment with her because I don't even think she does it anymore. But if you put your stats into AI, you just put your cancer type, your weight, it'll give you a whole protocol. There are so many ways to find out. And I've got a friend who was on her diet for 3 years. She then got taken off the diet by a doctor, and her cancer count was just like roller coaster for the next 4 years. And now she's gone back onto it, and her cancer count is halved within a month. So obviously she's on another different kind of chemo, but she went into AI and she chat GPT'd Jane McClellan's diet, and she said, it's so accurate. I wouldn't have believed it if I hadn't have met her, and for her to confirm what comes out of AI is pretty accurate. So you can even go in and Google those natural things and say, what are the natural healing modalities? But that is advice. It's free advice that a medical scheme can give a patient that is not going to affect the relationship between the medical scheme and the patient at all in any negative way. It's just going to enhance it.
It is amazing what is available out there. So it's just about empowering yourself. But I think there is such a huge role that medical schemes per se can play in a cancer journey. For that matter, maybe any illness, but this one specifically, it feels just so simple and so easy, right?
Yeah.
Carmen, thank you for your time. I really enjoyed that. I love your positivity. I love your resilience. And nothing's going to get you down. And I love that, your attitude towards life and your message to say that you want to help people better their cancer journey.
Yes.
It's amazing. So very nice.
Pay forward. Thank you so much.
Thank you for the chat, Carmen. Really appreciate it.
Thanks, FAnews. Nice to meet you.
Nice
Bye.
to meet you.